In 2005, when the Rand Corporation wrote about early childhood interventions, they argued that the evidence to date showed those interventions improved outcomes and generated benefits that outweighed the costs. More than 10 years later, the number of programs and studies has increased by a factor of 5. There are more than 3 times as many benefit-cost analyses. We've given you a lot to think about in the last 3 weeks, but how do we use all this data to decide what to do in the future? That's the topic of this week's Healthcare Triage. With so much more data, we can make even stronger arguments. Let's start by going back to the primary study questions, which you will remember were the framework for the 3 preceding episodes. What program approaches to providing services for families and children from the prenatal period to school entry have been rigorously evaluated? Episode 1. What outcomes did those programs improve in the short and long term? Episode 2. What are the costs and benefits to effective programs and returns to government or society? Episode 3. We talked about the 115 programs that represented the 4 approaches to intervention: early childhood education, home visits, parent education, and transfers. We talked about how most programs were either early childhood education or home visits, alone or in combination with other approaches. And we talked about how the evidence was pretty robust. Almost all the programs had at least one randomized controlled trial testing them. Then we discussed the outcomes. The 3 most common domains were behavior and emotion, cognitive achievement, and child health. 102 of the 115 programs had at least one significant positive outcome. The magnitude of the effects were modest for both birth outcomes and substance abuse in adulthood. Consistent with other analyses, they also had significant effects on children's cognitive achievement and behavior and emotion. Finally, we discussed the economics of early childhood interventions. There aren't as many of those as there are evaluations of outcomes, but still, there are plenty. They range in how much they cost, from a few $100s to about $50,000 per kid or family, based on how intensive they were. Benefit cost analyses show that, in general, these programs seem to provide quite a bit of bang for the buck. So what do we do with this? The authors of the report have a few suggestions, and they're worth considering. Let's first focus on the implications for policymakers and policy. Policymakers can be highly confident that well-designed and implemented early childhood programs can improve the lives of children and their families. Not every program improves every outcome, but in general, there's a pretty robust body of evidence here that early childhood programs improve outcomes. The good news is that policymakers are listening. The omnibus bill from earlier this year added more than $2.3 billion to the Child Care and Development Block Grant. An additional $400 million was added to expand the Nurse-Family Partnership, a home visiting program. State funding for preschool has also been on the rise. With a robust base of early childhood programs that have been proven to be effective based on rigorous evaluation, decision makers should integrate other criteria when selecting programs to implement. All of these programs are now evidence-based. That's not what makes one better than another. Policymakers should consider what outcome they're trying to improve and then look for the program that gets them what they want. Context and implementation are very important. Consider the surroundings. A transfer program may need to adjust the type or amount based on a range of factors, including geography, the population being served, and existing resources. Program implementers adopting or expanding evidence-based models should pay attention to replication, implementation, and the returns. This is an ongoing theme of Healthcare Triage videos. Because something works in ideal conditions, efficacy, does not mean it works as well in the real world, effectiveness. In this case, as policymakers implement evidence-based programs or expand them or change them a bit, they need to study how well they do and if those replications succeed. If not, we need to figure out why. New approaches to universal programs raise the possibility that such programs can complement rather than substitute for targeted programs. Whether a program should be universal or targeted is always a debate. In the past, targeted programs were popular, as resources could be aimed at those who need them the most. Think Head Start. The targeted population also had the most to gain, so you might get more bang for the buck. But universal programs can also do well. Think Universal Pre-K in Florida, and can sometimes be even more cost-effective because of economies of scale. Policymakers need to figure that out at a local level. Benefits can take decades to exceed costs, posing challenges for funding mechanisms that require short-term payoffs. Early childhood interventions are not for the impatient. It can take decades, literally, to see the gains you're hoping for. This is a long-term investment, and we've all got to be prepared for that. Beyond policy, there are also implications in this work for research. Let's review. Comparative effectiveness research can add value to early childhood program decisions. When many of these programs started out, they were rare enough that they needed to be tested against nothing or usual care. That's clearly no longer the case. Now we're at a point when we can start testing programs head-to-head to see which are better and in what situations. The next generation of research needs to get inside the black box of effective programs. Now that we know programs work, we need to figure out why they work. What are the critical aspects? How much of them do we really need? What can we trim? Are there aspects that don't work? Answers to these questions and more might make it easier to make current programs more efficient and future programs better. The Community Guides Review hammered these issues home as well. Even when we focus on just early childhood education, so many unanswered questions. At what age should we start? What's the ideal student-to-teacher ratio? How much do we pay teachers, and how are we to train them? What's the minimum length needed for results? What's the relative importance of various components? Why do effects diminish over time? Should we offer meals and healthcare too? How much difference does that make? And more. Early childhood programs improve a range of outcomes, so evaluation should collect outcomes across a range of domains. Too many economic analyses focus on the same small set of outcomes. The set of available studied outcomes is much, much larger, and the former should reflect the latter. Outcomes for 2 generations should be captured in early childhood program research. Parents can derive benefits from early childhood interventions as well. These can be direct, for instance, parent education, and indirect, for instance, better ability to work because of interventions on kids. And that should be measured too. There's a need for more studies that conduct longer-term follow-up to determine whether early program impacts are sustained. While a few programs have been studied for decades, most have only short-term outcomes. We need longer-term outcomes for more programs. I'm not saying this is easy to do, but we really need to do it. Incentivizing cost data collection, as well as standardization of BCA methods, would also facilitate comparisons across programs. Part of the problem with the study of early childhood interventions and the analyses that evaluate them is that they use different metrics, different data, etc. Ideally, they would use the same metrics so that we could compare them directly. Too often in this kind of research, we don't do it because we want to look good. But getting researchers to collect better data we could all use is in all of our best interests. All of these are good ideas. They all have merit. But as we end this 4-part series, let's remember what we've learned and what it might mean. Early childhood interventions work, and work well. They are often worth more than what they cost, and there's an argument to be made that we're underselling them because the benefits can last a lifetime. Of course, in order to maximize those, we need to make sure we don't drop the ball in middle childhood, adolescence, and beyond. But those are topics for other videos. Thanks for watching.